Welcome to the office.
Welcome to the office, brother.
Thank you.
Nice to see you. Nice to meet you. What brings you here?
Ever since I could remember, I've had a lot of back pain right here specifically.
Top right shoulder or
Top.
behind their shoulder?
Both.
One
but
more
mostly,
time. The wing bone
Yeah.
on the back side.
Yeah, right here.
Okay.
Right here on the back side. And I've been to...
Hold on.
Oh.
When you say as long as I can remember, how's your memory?
Not so
5
good.
years?
Not so good.
7 years? 10 years?
I'll tell you.
Yesterday?
I'll tell you, like, probably since I was like 10. Like, truthfully.
Okay.
And
What happened? Do you remember
I
an
don't-
injury?
So I want to say it's from a injury I had in a football game because I used to be in football, and I want to say it's from that, but I'm not 100% sure.
Okay.
So, and I've been to doctors, physical therapists, chiropractors, and they all tell me, "Oh, you're young, you'll get over it." And,
The right wing bone,
Mhm.
since you were 10, has been bothering you,
Yeah.
paining.
Yes.
How is it affecting quality of life? Because to come here from Miami for a shoulder thing is a big deal.
I mean, there's not a time where I have zero pain. There's always at least a little bit.
It's
of pain.
always nagging.
Yeah, it's really nagging. There's two things that got me.
What else?
So I was gonna have
My great videos.
So I was gonna have septoplasty surgery because I have a deviated septum and I can't breathe,
Okay.
and I really hate surgery. And then I saw your videos on you fixing the septum, so I was like, even if there's a chance that it will help versus having surgery.
You've watched me do adjustments on the septum,
Mhm.
and I will talk about it just briefly. So the idea is this.
Mm-hmm.
I'm not adjusting a bone, nasal bone. What am
Mhm.
I adjusting?
The
So there's the bone is here.
right.
Then there's the junction right there where the cartilage is. And that can misalign, okay? If it's the nose or there's a turbinate that's deformed, or have they ruled all that out? Have they looked inside? Have they done?
They told me the turbinates. I think there's two of them, right?
Yeah.
They said they're too big.
Okay.
They're gonna make them smaller.
So the question is, why are they big?
I don't know.
All right, maybe there's a nerve involved. Maybe there's an upper cervical issue. I don't know. Now, I will test your breathing before and after the adjustment.
Okay.
Okay? Any other issues going on?
Not really, no. I mean, my ankles are in pain. I mean, that's just from me being wild and,
Fun.
you know.
What are you doing for activity right now? You're
Oh.
working out, walking,
So,
hiking,
okay.
swimming,
So-
wakeboarding. What do you do?
So I like to lift, but honestly, because of the back thing, I'm like afraid to do certain exercises, like from squatting, like bench pressing. Even when I bench press, you know, you're supposed to have like straight, but sometimes I have to bench press like this because of this.
You're
know.
compensating.
Yeah.
Okay.
And I don't want to injure it more than what it is, so,
Okay.
you know.
Here's what I need you to do while you're here, and you're going to be off the gym for about a month. You're going to focus on your movement. We're not strengthening an injury or an imbalance. We're going to fix it first through your walking, 10, 12, 15,000 steps a day, or hiking, or elliptical with handles if you want to go to the gym, cross-country skiing type motions.
Right.
You're doing that an hour, hour and a half a day, or the 10, 12, 15,000 steps, okay? That's number one. I'll give you a few other things to do, and this is to prep you so when you go back to the gym, you're back in balance.
Yeah.
Make sense?
Yeah.
Okay, let's do the exam. Let's figure out what we find.
Okay.
Okay?
All right.
Along the way, you got questions? Ask.
I do have a question.
What?
I feel like, I don't know if this is true, but I feel like this shoulder is shorter than this shoulder.
Okay?
And I also think that maybe, I don't know, maybe if it's because I'm a side sleeper, maybe that's what
Okay.
does it. I don't know.
Let's look at your x-rays. X-rays don't lie.
Okay. All right.
Let's take a look.
All right.
Guys, we got a bigger monitor here, and we're able to put it up here. We're able to do the listings now on the full spine, so we got everything in one picture now, okay? Now, this is you, 24-story building. This is the foundation of your 24-story building. You're complaining here of this right side, okay? We're going to get to that. We need to first talk about this foundation. Starting in the foundation, we have a few things going on. We have a rotated pelvis of 11 millimeters to the right side. We have a rotated sacrum, P3-L on the left. I'm going to put it together for you.
Okay.
Most important though, and your shoulder will never get fixed unless this is under 6.
Okay.
You have a measured difference of 13 millimeters. Now, let's talk about a couple of things. If I correct your pelvis, I'm going to make your hips worse. So if I correct your pelvis, I make your hips worse, nothing gets fixed based on this analysis. So it tells me we're probably going to start somewhere in your tailbone, number 1. Number 2, we got to figure out to get that up to 6. I don't have the answer just yet. We're just starting.
Right.
But we'll hopefully have an answer in the next day or 2, okay? This needs to be under 7, 6 millimeters or less. If I adjust your pelvis, I make it worse, so we know the pelvis is not the answer. We do know there's a tailbone issue there, and when I get to this x-ray in a little more detail, we had an old tailbone injury at S3, S4. That's what started this process. Okay. Now, as we go up the spine, once the follow this. If this right side is tilting down, what's the it's doing what? It's compensating to the opposite side.
Right.
But then what's it doing at the mid-back? It wants to come back to the right. So if we're down on this side, look, watch the shoulder. I'm exaggerating. We're like this.
Right.
You keep trying to lift this up, this keeps pulling you back down.
Oh, yeah.
This ain't a shoulder case.
Gotcha.
Okay? Make sense?
Yeah.
Now, I may correct myself again because we have a couple of things going on here. T1, 2, 3 side slip, 4 side slip, 5 side slip. You played hard. You got hit stuck good. That's all right. But these side slips tell me you had some blood traumas and it's shifting your whole upper thoracic spine neck like this. So we have a short leg. I got to go through this.
Right.
We have a short leg on the right. Sorry, we have a lower leg on the right. We have a kink in the mid-back. The kink in the mid-back is causing your digestive issues we're going to talk about in a minute.
Okay.
So you're like this, watch. You're like this. This is low, this is like this. You're trying to straighten out here, this and this is bringing it right back down. So the fix of your shoulder is going to be the mid-back and the foundation.
Okay.
Makes sense?
Yes.
This area controls your digestion, we talked about, right? Generally speaking. I'm looking here at this we call the Blvd, the gastric air bubble. You've heard me talk about this stuff, right?
Yeah.
So you got the air bubble is small. We have some digestion, some congestion. We're not absorbing and assimilating as well as we should. The good news is, again, you're young enough. We'll see what the adjustments do. If it's not changing in a couple of days, I may give you a supplement or suggest something for you to take or change in your food. Okay? Now let's go to the side profile. Side profile. So the first thing that threw me off when I looked at it was it's a rotated L5. It's gone back quite a bit. 5 is tilted, 4 is tilted, 3 is tilted, 2 is tilted, 1 is tilted, 12 is tilted, 11 is tilted, 10 is tilted, 9 is level. So everything from your foundation to your T9 is compensating. Anything going, all of this is a compensation to your foundation. Got it?
Got it.
All right, let's continue. As we go up, but the good news, your discs are all still good.
Okay.
Great, no issue there. I'm saying they're tilted because they're compensating. Okay, we get to the neck. Your discs are good, but you got a straight neck, which is starting to create a little bit of that reversal, but it's more straight. We have a slight disconnect between 2, 3, C4 and C5. This is what I see, and obviously it's whatever I find on you. For me, for you to help you the most, figure out the foundation, probably going to be somewhere in the tailbone. If I don't know that I'm going to get to that 5 on this trip. Okay, it makes no sense to give you like a day relief for that, but I'm hoping through the sacrum adjustment that we can get some good changes here. Whatever I find up in here, I will deal with. If there's anything going on in the neck, because then there's the actual direct nerve from the neck that goes to the shoulder. That's also a possibility.
I have pain there too.
Yeah. But what I'm trying to explain to you is a lot of this is a compensation for your foundation.
Right.
But let's see what we find.
Right.
Does that make sense?
Yes.
Both x-rays?
Yes.
Questions on the x-ray?
No.
Ready to start?
Yeah.
First thing I want you guys to see is this, that on this is his upper body here, this is his foundation. So bring your belly button in and up. In and up. So bring the belly button in and up like this.
Like this?
Yeah, so move it in and up, right there. That's his posture. That's where he should be. Relax it. Okay, go ahead and walk to the corner of the room and back, please. You're gonna do this 3 times, sir. Keep calm. Well, you definitely got the Miami wiggle. When you're walking, they're shifting side to side, okay?
Really?
Yeah. We have up and down too,
Okay.
so that's good. Have a seat, please. The right side actually moves up and down pretty decent. I wasn't expecting that. Let's see what we got here, starting at the base of the neck. 15 points, T5, T6. Switch sides. Switch sides. Switch sides. 10 points. So it goes left. And then you think it's going to break, it doesn't. It goes right. You think it's going to break, it goes left. And then it breaks at the tailbone. Okay, let's do static palpation. Running our fingers down the spine. You can see right there the edema and swelling starts right there, pulls in. 1, 2, 3, 4. Tender. Yes?
Yeah.
7? No. Starts at 6.
Yeah.
That's your digestion, brother. Okay. Open and close the knees, feet touching. Open the knees, close the knees. Open and close. You can see the swelling, that's inflammation of the tailbone. The softer it is, keep going. Softer it is, usually newer. Harder it is, usually it's been there a while. Left side only, please. Right side only. They're both stuck. But what's interesting, do the left side. Check out what's happening all the way from here, though. When he does the left, there's a little tinkle right there. Do the right. When he does the right, there's way more over here. And that's more consistent with the rotated sacrum on the left side. Now, L5, S1, 2. Come back towards me, brother. Tender.
Yeah.
That's 4. I'm sorry.
Sorry.
That's 5. Not as bad. Starts at 4. Yes?
Yeah.
So come back slowly. This is your 5. 5 is little tender, yes?
Yeah.
But it's starting where? At the bottom.
Yeah.
Okay. 6, S4. Let's check up top. Sit back for me, please. Let's check the movement of the neck all the way back towards me, please. Look up and down. Look up and down. Left and right. There it is. Sorry, I'm not going to go harder than that.
Sorry.
Stand up for me, please.
All right.
Raise your right leg. Leg down. Raise your left leg. Harder on that leg?
A
Or
little bit.
not really.
Not really.
Left side again. Just took a minute to get balanced, that's all. Right side. Okay. That's fine. Have a seat, and here's my game plan for you for today, okay?
All right.
We're going to do upper cervical C1. Correction, we're going to do upper cervical critical atlas, and we're going to do S4. Then I'm going to have you walk, and then we're going to retest everything. Fair enough?
All right.
You got it, buddy. Down right, down left. Let's go back there. We're going to set C2 on the left. So C2 is actually wedged on the left. C1 is swollen on the right capsule. Okay. Nice and easy, brother. Look up You want to get right under the spinous bifid of C2 on the left side, hooking it with the distal palmar surface. We're getting it right underneath there. There it is. You okay, bud? C1 now, okay?
Alright.
Now for C1, I'm gonna come slightly anterior with the elbow, take a soft pinch, find the lockout, and set. Nice. Walk it off, sir. Check out that wing bone. Move it.
Oh, it's feels a little different. My head feels lighter.
You did eat though, right? You're
Yeah.
hydrated? You
Yeah,
did
yeah.
eat, okay. Let's go face down over here on the gray table.
Okay.
Shasha! We haven't called Shasha in a long time. I'm gonna need Shasha for this one. Now, we got a short leg on the right, so we need to torque that thing up. Nice and easy. Hands forward, brother. Salat. Palms up. Palms up. Elbows out. There. Relax into the table, please. Into the table. He's quick. Ah, gotcha. Home run. Thanks, Shasha. All right, walk it off, please. Survived part 2. Keep walking, please. You doing okay there, Abby?
Yeah.
What's going on as you're walking right now? You okay?
Yeah, I feel good.
Right side down. Okay, so we're doing sacrum. Let it roll, let it roll, let it roll. Oh, that's the home run. Like butter.
Feels good.
Come on up, walk it out. Now, you're gonna walk 3 times back and forth. As you're walking, move that shoulder around. Tell me if anything is different. I have not touched the shoulder.
Yeah, it feels a little bit looser.
Different.
Yeah, feels different for sure.
Have a seat. Different good, different bad.
Different good.
Okay, just had to clarify. Okay, head down. Let's re-scope, starting at the base of the neck. Now here's the interesting part. Without those x-rays, I probably wouldn't have seen that critical atlas. Think about it. So it's a lot harder to see that on the without the x-rays. So if I didn't have that, I'd have probably just did his atlas on the left, and that would have actually been wrong. T6, clear. S4, still got a tiny bit, but you will see a few times it'll clear out. He's going to need a lot of walking. 1 point, I'm fine with that. Come back slowly, tell me what's different. This is L5. L5, S1. Different?
A little bit of pain.
Different though from before.
Yeah.
2.
Yeah.
3. This is the one I did. Do you remember?
Yeah. Yeah.
20% less?
Yeah, yeah. It still hurts though.
But it's different.
Yeah.
That's where we're starting. Okay?
Yeah.
Now, let's continue.
Okay.
Sit up straight. Shoulder. Relax it down, down, down. Left shoulder down. There you go. Okay. Let me check the movement. Let me do the work. That's going to show up later. Let's go work on your nose. Face it. So your x-ray actually shows, let me see if we can see it. Slight bump from the right side. Okay. Shows it on this side, right there. This side is, breathe in through the nose and out. Breathe in through the nose. We're going to do right to left there. Okay, chin down. Try not to contract now, just let it relax the best you can. You okay there? Breathe through the mouth, please. Chin down. There you go. We've got to do the TMJ. There's a connection between this I can feel and the jaw. Right there. Right. And the reason why I need to work on that also is this. There's what's called the pterygoid palatine ganglion that sits behind the TMJ, the jaw. I was feeling something over there. There are connections that go to the glands of the face, including the breathing mechanism, okay? Have a seat over here. Let's check that jaw now, please. Look up. Slowly open. And you can see the right side comes out first. Keep going. Open. And then the left side compensates. So the left is the compensation, right is the AI, and that matches his x-ray. We'll do a slight lateral to medial pressure of the left side first. Open all the way. Close halfway. Hold there. And I'm just putting lateral to medial pressure on the left side. Okay, close. Open and close a few times. Let me get the condyle block. And let's get a little bit more now of that right side. Condyle block, stabilizing. Look there. Open all the way. Open. Slowly close. There. Got it. Beautiful. Nice. Walk it off. Walk off that nose and jaw job.
Oh, it feels a lot different.
A little different, yeah?
Yeah.
What's different? Tell them.
My jaw feels lighter. It feels better.
Good. Are we smiling a little bit?
Yeah.
A little bit? Are you in hotel or Airbnb while you're here?
Airbnb.
Okay. Steaming is going to be very important for you.
Steaming?
Steaming. And the way I like to tell patients is old school. The way mom and dad used to do it, boil a pot of water,
Yeah.
put the sheet over your head, and just get as much. If you have access to the steam room, I would do it. If you're here, now I would like you to do one steam while you're here. So we need to figure out either you're at an Airbnb, you get a stove, pots.
Yeah, yeah.
Boil some water and cover a sheet.
Okay.
Do that tonight. No shirt, and just sweat out as much as you can.
Okay.
And then you can report back to us tomorrow,
Okay.
kind of what happened. Okay.
Okay.
All right. Last thing I want to do is go on your back. Let's work on your ankles. You just didn't know about that L5.
Yeah, I did.
Perfect. Over here, now you get a buff and polish. Vibration therapy. Frequency is 10,000 RPM or 180 hertz. When you go over normal tissue with the machine, it does nothing. When it goes over scar tissue or shortened ligaments or congestion, you can feel that little tickly spice, right?
Yeah.
All right, squeeze the hand, come over here. Squeeze. You heard me. Squeeze. You got a lot of people though. You heard me, I can't help it. That's good. Oh, that's good. Relax there. Relax there. Thumb. Lunate. Scaphoid. That's it. Watch out, please. Lunate. scaphoid. Thumb, trapezium. Squeeze. Squeeze. Welcome to the office.